March is Colon Cancer Awareness Month, and more than 100,000 people will be told they have this kind of cancer in 2019 alone. So what can you do to protect yourself? And how is Oklahoma doing when it comes to screenings? Joining me live in studio this morning is Dr. Aaron Sachdev with Integris. Thank you so much.
Thank you for having me.
For coming. It's a pleasure to meet you this morning. So March is Colon Cancer Awareness Month. What do you want people to know this time of year?
We're trying to encourage everybody watching to get screened for colon cancer. There are a number of things people can do to get screened. Colonoscopy every 10 years is recommended. There are other options including flexible sigmoidoscopy, barium enema, virtual colonoscopy, simply having your stool checked for blood or the DNA for colon cancer is possible. As a gastroenterologist here in the community, we focus mostly on colonoscopy, which remains the most common test and the gold standard for screening.
Okay. And if you get screened and you catch it early, what are your chances of fighting the cancer?
Again, you're right. The whole purpose of starting at age 50 is to catch cancers early. The earlier cancer is detected, the much higher chance of a 5-year survival. We also have much better therapies for colon cancer, so overall the chances of living are very good.
And I'm sure you see this on a daily basis, but I think so many people probably put it off for too long, don't do it at all, because there is some embarrassment associated with the screening, right? And what do you want to tell people who have a little hesitation to get it done?
You know, but most people do. They worry about the bowel prep the evening before. Nowadays, it's not the big gallon of Go Lightly that everybody fears. It's a 2-liter bowel prep, which is much easier to drink, which works fairly well. During the procedure itself, most people are covered completely. We have a large monitor in front of us that we use to project the high-definition video that's coming from the colonoscope. So everybody's covered, everyone's focused on the screen, and it's a pretty comfortable procedure nowadays.
And you're saying the colonoscopy is the most common. And for some people watching, you know, they're the type of patient that says, okay, if I know exactly what's happening, I'll be more comfortable. So what exactly does a colonoscopy entail?
So colonoscopy, you're on a clear liquid diet the whole day before the procedure. The night before, you'll drink a 2-liter bowel prep solution that will clean you out. As I tell people, put a reserve sign on the bathroom. The day of the procedure, you'll come in, have an IV placed, you'll receive sedation, you'll be completely asleep during the procedure. Our goal is to use a flexible scope to look for polyps. Polyps are what turn into colon cancer if left there. So if we see a polyp, it does get removed during the procedure. About 25% of men and 15% of women will get precancerous polyps, and that's why it's important to get screened.
Where do we rank in Oklahoma when it comes to screenings? Are we good at getting them? Not so great?
Unfortunately, we're not doing great. Nationally, about 67% of people get screened. In Oklahoma, our colon cancer screening rates haven't increased since 2012. We've kind of stayed at this 58% range. It may take a variety of things, state leaders, hospitals, insurers, doctors, everybody to get together to figure out a way to get our community to a higher screening level.
And we need people to get on top of it and on top of their health. How common is colon cancer?
Colon cancer is a common cancer. As you said, there'll be about 145,000 cases of colon and rectal cancer this year. It remains the second leading cause of cancer death among men and women combined. The good news is that colon cancer rates have been going down significantly over the past 2 decades in those over the age of 50.
Why is it so common, though? Why do you see this in so many people in so many cases year after year?
Right.
Is there a cause or anything that's contributing to its frequency?
Well, there are a number of things that can come into play. We worry somewhat about genetics. Approximately 20% of colon cancers have a family history. The other 80% are sporadic. We worry about diet, including those that consume too much red meat, especially processed meats. Obesity has seemed to play a part in our patients as well, particularly younger patients that seem to be getting colon cancer.
Interesting. And based off those things that you just listed, is there a certain diet that you suggest people adhere to, you know, maximum or minimum amounts of exercise per week? What do you say about lifestyle?
Yes, in general we do. We encourage a healthy diet, usually 30% fat or less. More fiber in the diet is thought to help. But again, number one thing is to get screened with any of the methods that we talked about earlier. Doing any one of those methods is better than doing nothing at all.
And as I mentioned off the top, you're with Integris. Is there anything being done research-wise at Integris right now to help keep this at bay for so many people?
Well, there are studies nationwide looking at chemo prevention. There are studies that show some benefit to aspirin use in decreasing the number of polyps formed and thus the number of cancers. But since 2001, when Medicare approved screening colonoscopy, and GI doctors around the country have been taking out millions of polyps out of people, there's been a dramatic 30% decrease in the new cases of colon cancer in just 17 years.
Wow.
So it's been shown to work.
In just about 20 seconds left here, I know you mentioned start to get a colonoscopy at age 50. Is that right? And is there anybody who should get one before that age?
So the American Cancer Society last year recommended starting at age 45. Whether that will get widely adopted, we think it will, but it may take a few years. If you have a family history, you should definitely get screened. Typically, let's say your mother was diagnosed at 50, you should get screened 10 years before that at 40.
Okay.
If you're having symptoms such as a change in bowel habits, blood in your stool, abdominal pain, weight loss, get checked.
Okay, so hopefully encourage people to go get screened, but also talk to your family, have this conversation about what runs within the family gene there.
Absolutely.
Thank you so much for your time.
Thank you so much.
We do appreciate it.